Hit record. Welcome to another Zoom call. If you weren't with us last week or you have not gone on the member site, you'll see the announcements. We can do cheek swab testing again. We've updated the cheek swab testing forms. We have three pages of the member site, so make sure you get on there. You can see the cheek swab agreements, which we always had on there. You don't need to look at that. The cheek swab testing request form. I do remember some people are still sending in cheek swabs without any request form, then we have to call you and stuff. So please send in that request form to make it easier. We've even made it an online form if you want, so people can do it online right there as well. And then you can order more cheek swabs and you can link to pay for your testing right there as well. It just saves us. We have less staff and anything that can just take some pressure off our staff, that would be great. So if you can link to pay for yourself right there, order more cheek swabs if you don't have any, and the form if you want to print it and send it back with your cheek swabs, or if you just want to do the form online, we've created that online form, just trying to simplify. The other thing, isn't a new announcement or anything, but please only ask questions on the member site, in the blue question box at the bottom. We occasionally still get people emailing questions in. They will not be answered anymore. We just, it just doesn't go, I don't see it and I don't see it till afterwards, and it's just, please ask the questions on the member site. And if you want to write programming update, if you want to update your frequencies, if you think you need them updated for any reason, fill out this cheek swab test form and do it via cheek swab test. It's going to even be better. So, okay. Remember, you all have access to all our courses. And remember also that the search bar is on our member site only now. It's not on our website anymore. And our 900 pages of blog post is only accessible to members now, not to the general public. So that's for you guys to look at. And if you have questions between these Zoom calls, please do take a few minutes. It may have already been answered in a blog post. Okay. Let's get to your questions. The protocol for chemotherapy says the day before chemo, water fast, but continue supplements. Should I continue taking vitamin C, which is an antioxidant, greens first and sun spectrum? Are there supplements that should be avoided around chemo time? Some that don't interfere with the chemo's ability to work, most definitely. So the general rule with chemotherapy, and understand this is not really a rule. These are just suggestions, because there's some natural doctors that say, forget it. Don't worry about not taking antioxidants during chemo. I follow the idea that it makes sense not to take strong antioxidants while you're doing chemo. Now, understand, if you take antioxidants, let's say your chemo is, so let's put a scenario. Let's say your schedule is you have chemo at 9 a.m. on Tuesday. That's your chemo IV. So that's a chemo infusion at 9 a.m. on Tuesday. So should you stop taking antioxidants on Monday? Well, really, your antioxidants are going to stay in your system. Your vitamin C has a half-life in your system that's fairly short. That's a water-soluble vitamin. It's not going to stay in your system very long, meaning the extra vitamin C that you took via supplement. Antioxidants like alpha lipoic acid and stuff some of them have a longer half-life, some of them have a shorter half-life. Resveratrol has a very short half-life, meaning that it's really out of your system. So should you stop the day taking any antioxidants the day before? You can. This is all optional. So you could stop all antioxidants the 24 hours before the chemo. In the chemo protocol, I just say don't take it with that 48-hour window. So in this case, in this example, that's why I wrote down that example, you're not taking any antioxidants from 9 o'clock Tuesday morning till let's say you got done with it. Let's say you finished the IV infusion. Let's say you finished at 11 o'clock. Okay, so then you'd wait till you started it at 9 o'clock, you finished it at 11 o'clock, then you would wait till Thursday, which is a 48-hour window that you would at when you finished at 11 o'clock on Thursday this is the window that you would stop doing the antioxidants. You wouldn't do the coffee enemas. You wouldn't do any really strong detox things because you want the chemo to be in your system for that time. Could you start a day before with that going off of all those? Yes, but remember what I said. There's some natural doctors that say, forget it, you should be taking your antioxidants throughout that whole time that you're doing chemo because it's really just protecting your healthy cells. It's not going to be protecting the cancer cells. So there's dispute in that. There are no studies that's either way that the chemo was more effective when people stopped their antioxidant. There's never going to be a study because it's impossible to really measure that. So it's just hypothetical based upon data that, hey, it does make sense. Chemotherapy is a strong oxidizing agent. Why be taking antioxidants during the chemo? But again, the opposing view is the antioxidants are only protecting your healthy cells, and that's what will help protect your healthy cells and help you from having, help you to have less ill effects of the chemotherapy. So that's step number one. Then step number two on this question is, okay, vitamin C is a strong antioxidant. Alpha lipoic acid is a strong antioxidant. There's a number of other ones. There's certainly antioxidants in greens first, but I would not say that taking greens first is a strong antioxidant. This is like eating a good diet. You don't stop eating a good diet during chemo. Sun spectrum has curcumin in it, which technically has some antioxidant properties, but I wouldn't stop taking sun spectrum. I wouldn't classify this as an antioxidant. So really your antioxidants would be your vitamin C, your alpha lipoic acid. Flavonoids have some antioxidant property, but I wouldn't even stop taking that. It's really those two biggies. And then part of the chemo protocol is also to stop any excess, you could say, liver detoxification. And that would really just be, don't do, and this is just within that 48-hour window, right? You're not doing coffee enemas. You're not doing castor oil packs over your liver. Things, that's the only thing that you're really stopping during that time. So that is really the chemo protocol. Remember, it's just a suggestive protocol. There's people that think differently with that. Now, your oncologist thinks the whole opposite side of the spectrum, which should stop taking all your supplements if you're going to do his care, from ground zero and you never take any supplements. That's just absolutely ridiculous. In an ingredients list, is coconut sugar the same as coconut palm sugar? Google search is not convincing one way or another. Thanks. Well, I'm not any better a specialist at that either, so I don't have the answer to that. I apologize. I don't know the difference between coconut sugar and coconut palm sugar. I think either of the sugars are acceptable, much healthier sugars for us, but I don't know the difference between those. Maybe somebody else here does. I've decided to try an alternative to letrozole. So letrozole is an aromatase inhibitor, which decreases bad estrogens, excuse me, decreases all estrogens in your body. Because my bones were aching, my eyes were so red and dry, and constant dry eye drops did not help. So any of these medications have a lot of side effects to them, and certainly the side effect can be coming because it is a chemical that's affecting other things in your body, and the side effect can be coming because it is doing what it's actually intended to do, which letrozole is meant to drop all estrogens down to almost nothing, and then you're going to have side effects from not having estrogen because you're supposed to have estrogen. Question goes on. I have AromaClear, AstroClear, and Alavia Immune. So the Alavia Immune is not has nothing to do with lowering estrogens. This is an immune stimulate polysaccharide. These two products, as well as I've ordered sulforozyme. So these two products and sulforozyme will help lower bad estrogens. Since I'm using them as an alternative, what is the recommended amount I should take? Well, the AromaClear, typically I'd recommend 2 to 3 per day of these. And this also has to do there's some caveats to these too. It depends on, if a person is in relative remission, then they can be on less. If their cancer is growing, then they want to be on more. And this is assuming that a person is either ER, PR, or HER2 positive. If you're ER negative, PR negative, and HER2 negative, or what's called triple negative, still there could be benefits to taking these products because personally, I don't necessarily completely trust their testing. So the AstroClear is a lignin product that I would take again about 2 to 3 per day. And the sulforozyme is a broccoli product that's one of the cleanest on the market. This can be really effective, not just to lower estrogen levels, but it can actually be a cancer killer and a hormone balancer as well. And this one I would suggest at least 4 a day, probably on this one. And you could go, lots of times I put people on higher doses of sulforozyme. And are there supplements that should never be taken together? No, you're not going to have any issues with any of those. You can take all those together. I've watched your video on juicing. I'm still fuzzy on what I should do according to my genetics. So I do have a video, juicing versus blending. If you haven't seen that, you can go, it's probably on the member site. It's certainly on our YouTube channel. There's positives and negatives to both juicing and blending. So one of the things that I recommend based upon genetics, so we talk about genetics preconditioned to whether a person should juice or they should blend, has to do with the gene called the HIF1 gene. So the HIF1 gene, I have a video on it. You can watch. It's in the genetics. Read Your Genes course. Might also even be on the member site, because the HIF1 gene is important with cancer patients. If you have a lot of defects in this gene, it means that your cancer can be fed. It has a higher degree chance that it's fed, that your cancer is fed through glycolysis. So if your cancer is fed by glycolysis, that means it's using glucose, right? So if it's using glucose to feed on, you don't want to be juicing as much. So juicing is taking out all the fiber out of a food product and you're just getting the juice. Now, the proponents of juicing say that's the way to go. You don't need all that fiber. You could drink a whole lot more juice if the fiber is removed. So therefore, you're putting it through a juicer. There's different varieties. I won't get into that. But then you are drinking that juice, and in a Gerson protocol, you're drinking, anywhere between, 8 and 15 glasses of this juice a day. That's a whole lot of ounces of juice, which is very concentrated. Any juice, even vegetable juice, even green juice, is going to have a lot of glucose, but certainly if you're going to add carrots, apple, celery, which is a typical Gerson type juice mixture, it's going to be very high in glucose. If you got a lot of HIF1 defects, chance that your cancer is using glucose as a fuel source is very high. Probably not a good idea to juice. Well, aren't you getting the same amount of sugar when you blend? Well, remember, when you measure your total numbers of grams of glucose that you're consuming in a given day, you can instantly subtract the grams of fiber that you're consuming. So if I look at a product and the product has 6 grams glucose and it has 3 grams fiber, then I really only have a total of 3 grams of total glucose, because the fiber will attach to the glucose. And it's the same way with blending. If you're blending, you're getting all the fiber of the product as well. You're really offsetting the glucose. You won't be able to drink nearly as much. If somebody could drink 13 glasses of blended vegetables a day, they would probably explode. You can't do that. So you'll drink a whole lot less. You're going to get fiber with it, will help offset some of the glucose. So if you have HIF1 defects, or if I've told you that you have to really be on a low sugar diet, I would suggest, either doing a little bit of juicing, not a lot of juicing, or doing blending. Is it okay to remove the little rubberized clamps? And I assume you're talking about these things on the outside of your machine. This is the F117. This is the F122. Yes, you can. You could just unscrew those. These are to wrap the cord around. If you're traveling, it makes it easier. Also, there used to be a handheld ground thing that would attach to that side on these units too. They don't use those anymore. But you could remove those. I've removed mine on the side of mine. So yes, you can. Okay, questions from the chat. I have breast cancer. My markers are going down. Tumor seems to be shrinking, but the breast is swollen. I feel this is inflammation. Is there something else I could be doing to reduce this? So when you have any swelling, remember, it can be a good thing because it can be your immune response to the area. So I wouldn't, if I had breast cancer, I would not put anything topically on it. I would consider using flavonoids. We talk about flavonoids all the time here because they are your first go-to for any type of swelling, inflammation, brain inflammation, and that is the standard flavonoid. So if you have any type of inflammation, I helped my daughter and son-in-law move last weekend. That's why my throat is like this. just going in and out of the house. I caught a little bit of a cold. But I'm not a young chick anymore and doing the work of a 25-year-old can have taxing events on your body. So this is what I've been taking a lot of since this weekend. These are anti-inflammatories. So e.g. CG from green tea extract, curcumin, resveratrol, quercetin. These are your flavonoids. These are things that everybody, I think, should be taking constantly because of their benefits to decrease inflammation in your brain. So want to stay young, healthy, and keep a healthy brain, you need to be consuming tons of flavonoids. What time of day is best to take the medicinal mushroom powder, and how much water? So time of day is not as important as just, as so some people say you should take your supplements in the morning because you need the energy through the day, and there's benefits to doing that, especially if you're taking adaptogens to help balance your hormones and such like that during the day to keep your energy up. And yes, you do need nutrients to fuel your body during the day, but remember, everything has a half-life. So is it good to take, all your supplements at night? Well, your body needs anti-inflammatories and nutrients at night. Things are still happening at night. Yeah, you're not burning energy via muscle tissue, but your brain is still functioning. So there isn't a horrible, reason. There's not a giant reason why you shouldn't be taking things before you go to bed, except that they're just sitting in your stomach, and the capsules can irritate your stomach. The best way, what I used to tell people all the time with your medicinal mushroom mix with Sun Spectrum and Greens First, is I used to try to get people to sip it for several hours because they have a half-life, and it'd be better to spread things through the day. So it'd be better to spread your supplements throughout the day. Now, the problem is that most people were like, I can't, what am I going to just carry this around and sip this all the time? Well, the next best thing would be to break it into several doses. So, and then you're taking a dose in the morning and a dose in the afternoon. So you got an AM and PM dose schedule. And that's the way it is best to take all your supplements. The more you can break them up, the better, because of that issue that you're going to lose them as you burn them and as your body uses them throughout the day. I'm not sure you're able to answer this, but at what point do you decide to stop conventional treatments? Oncologist said I would need to be on Ibrance the rest of my life, even if the markers are at 0. I'm trying to decide at what point I would be smart to stop treatment. I have a CT and bone scan in February. He did tell us that he will support us no matter what. We do realize that he isn't familiar with supplements, right, emotional treatments, etc. Yeah, I can't answer that question. That is a question that everybody has to answer themselves, but you pray for wisdom and you're seeking wisdom. And let's say your scans come out really well. And it's like, okay, well, there's nothing wrong with saying, after you prayed about it and really sought an answer from God about it, if you feel peace about stopping something, it doesn't mean you have to stop it forever. You could stop it and, do some retests in 3 months. If your numbers go back up, then you can go back on it. So I don't think there's anything wrong with pausing things. What is your opinion on taking zeolite? So zeolite is a binder / chelator. So I don't have any trouble taking zeolite. The only thing you have to be careful with any of the chelators. So a chelator is something that is a nutrient that grabs onto chemicals and heavy metals. Oh, well, I want to take that. Well, you got to go back, and you guys all have access to my 7 Phases of Detoxification course. Highly recommend that you go through it or at least skim through it, because that will tell you that you have to make sure all the phases of your detoxification pathways are open before you do chelation, which is in my book, phase 0, which is the last thing you would do. Well, I'm doing all these other things. I've already done I do detox all the time. I'm doing coffee enemas. Okay, that's great. Then maybe it is time for the chelator, but there's several things that you really have to know. You don't want to take any strong chelators if you have heavy metals in your mouth, like mercury fillings. So if you have mercury fillings, you never want to take strong chelators. So if you still have mercury fillings in your mouth, silver fillings, then you can never take strong chelators, because you will just pull it out of your mouth and put it into your body, and that will not be a good thing. Second thing is if you have a metal implants. So if you have metal implants in your body, you just should never be on strong chelators. Well, what's a strong chelator? So strong chelators would be the EDTA and DMSA, that's what it's called. Those would be the strong chelators. So that would be in our Chela Clear, which is our phase 6. I would not take that product. Can you take zeolite? Zeolite would fall into a medium chelator, medium strength chelator in my book. You could probably get by taking zeolite with metal fillings or mercury fillings or dental implants or metal implants. But just don't overdose on it. What are your thoughts on ammonia scavenger? Ammonia scavenger, I can't remember all the components of it, but it's a great product to decrease ammonia in your body, especially if you have genetic tendencies to gather too much ammonia. If I understand correctly, still confused watching the video the day before. Okay, I just answered that question. That was, you must have jumped on late. So you can listen to that recording. Is Keep One a good replacement for resveratrol? Good question. So if you need to get resveratrol from us, just call us. We can get that. We just can't have it on the store, on the public site anymore. Orthomolecular just changed their policies. They don't let anybody sell online. So we can still get that for you. Let me look at what Keep One is. I can't remember what's in Keep One. I don't recommend it really that often. No, it doesn't have any resveratrol in it at all. So no, I would not say that that's a substitute. I'm considering doing Hulda Clark's parasite cleanse since it's relatively inexpensive and couldn't hurt, right? One of the things she pushes hard is her zapper. Well, her zapper is a Rife-like tool that it's like either, with the True Rife, it's like driving a Ferrari. With the zapper, it's like walking. I mean, it's that difference. It's not even, I don't think it's even a Rife. So just use the parasite frequencies on your Rife machine. So I'm very, big into using frequencies, obviously. And when Hilda Clark created that zapper, that was even, I think, before True Rife existed. So it was a long time ago. That's an old piece of equipment. Not very big fan of it. So use your Rife, and you can certainly do whatever nutritional protocol that she's recommending with her parasite cleanse. You can also look at our parasite cleanse bundle that I put together if you're interested in that as well. Could you prescribe chymotrypsin and trypsin along with my current digestime to continue to help decrease my tumor? The Kelly protocol. So let me look at the particular enzymes in these products, if you'll give me a second. So the answer to your question is yes. I just had to find the product that would be the greatest concentration of those. So you have to give me some time because we have so many enzyme products on our store. But Steve, yeah, I can get back to you on that and let you know. Um, what is the reasonable productive amount of blended smoothie to consume in a day? I think a reasonable amount, if you're drinking 32 to 40 ounces, boy, that's a lot. That's an awful lot of fiber, and that could get you bloated. I would say probably a maximum of maybe 12 ounces twice a day would be really a maximum. That's what I would say. Also depends on your weight. That's for me a pretty big guy. You maybe even less than that. 2 8 ounces glasses a day would probably be maximum. I've had a low hum in my right ear since around Thanksgiving, which I only notice when all is quiet. Is there any reason my dietary or supplemental program would give me tinnitus? My weekly practitioner, who muscle test, said it's from the vaccination shedding. Others, not me, that I received from somebody else, not me. Not sure if I should be worried. Seeing a new oncologist on Friday. What should I ask him to investigate further? An oncologist wouldn't investigate anything. They would just send you to an ENT doctor. Um, if so, number one cause of tinnitus is a reaction to a medication. Number two cause of tinnitus is toxicity. So tinnitus is caused from inflammation or plaquing on the audio nerve, and it isn't an easy fix because if there is plaquing on that nerve, which is a cranial nerve, it can be permanent. So there are some, tinnitus fixes you might have seen on Facebook and stuff. They just do not work. Nutritionally, the biggest thing that I would say that you'd want to help nutritionally that would help support it would be the delta tocotrienol, which is the inside delta form of the vitamin E. That's what's in APOP E. That is actually that delta tocotrienol part of the vitamin E molecule is what helps the inner ear. It helps the audial nerve. It also helps your cranial vessels. Your ear is innervated by what's called a terminal vessel, meaning it doesn't have other vessels feeding it vascularly, so oxygen. So a terminal vessel is one that doesn't have what are called anastomosing vessels that are also feeding it. The same thing is true with the vessels of your heart. Certain parts of the heart are only fed by one vessel. And if you have a heart attack, you don't have other vessels feeding that, and the heart can stop and cardio cells can die. That's what a heart attack is, because you have terminal vasculature in the heart. You also have it in the ear. So that part of vitamin D, the delta tocotrienol, is so good for those vessels. So remember I said number one cause of tinnitus is a reaction to a medication, which is basically a toxicity. Number two is really the same thing, toxicity. But you can also have issues with hearing loss, and tinnitus because of contraction of those terminal vessels. So you actually have decreased oxygenation to the tissues. So delta tocotrienols, and that's found in the APOP-E. And the reason why I call it APOP-E is because it helps promote apoptosis. It's the vitamin E that helps promote apoptosis. And it's been shown in multiple studies as a quote unquote cancer killer because it helps support apoptosis. But it does so many things for your vessels as well. So APOP-E is a great product for your heart. Why did I name it APOP-E? Because mainly we see cancer patients. So we could have named it like Cardio E or something like that too, because it is the type of vitamin E that you want for your heart as well. What do you think about SOT or DT, where they take your blood cells and train them to attack your cancer? Yeah, we've had some patients go through SOT therapy. There's a clinic down in Florida. There's one in Arizona, I think, that does it, and there's some in Mexico that do it. I don't know. I had one person recently that started it, did several sessions, and then stopped, didn't think it was helping her. And I had somebody do it about 2 years ago. They thought it helped them, but they were doing so many other things too. I don't know how they could have discerned that. But I've heard good reports. So yeah, I'm not against doing a lot of these alternative things. Also, I cut out sweets and just about all sugar 2 years ago. Why is my hemoglobin A1C stayed around 5.6 and 5.7 in the past has always been lower? There's other factors with hemoglobin A1C, not just your sugar consumption, has to do with your cell membranes and healing your cell membranes, and that takes a lot longer time. It has to do with, so your insulin receptors on your cell membranes don't change easily. So, and then, when you increase insulin receptors on your cell membranes because of a bad diet for a long period of time, that's the problem with diabetes type 2, is that you got somebody with type 2 diabetes and you think, oh, it's just an easy fix. You're just going to go on a complete no sugar, no carb diet, and that's going to fix your problem. And people can't figure out why it doesn't fix their diabetes. They still have elevated glucose levels. It's because you've damaged your cell membranes, and as that cell replicates a new cell, it replicates a new cell with that same amount of insulin receptors on it. So that's really the issue. It's a cell membrane issue, and it just takes a long time to move that needle. Been taking clear quercetin powder. 1 scoop seems to amp me up. Is this common? quercetin is a flavonoid, so it's going to decrease inflammation in your brain. And by doing that, it can actually increase your brain power. So it's, it also is going to increase your blood flow. So an anti-inflammatory is going to decrease the inflammation at your uh, um, uh, vascular level as well. So it's going to increase the blood flow to your brain. If you need to spread that out, just take a half a scoop in the morning, half a scoop at night. Again, like any other supplement, that's good to spread it out. Are you familiar with Linda Isaac's protocol? So Linda Isaac is who used to work, oh, she's right here. She worked with Dr. Gonzalez, started her own practice. Well, she had a practice with Dr. Gonzalez, and when Dr. Gonzalez passed away, she basically took it over. So I believe that her protocol is still using, much of Dr. Gonzalez's protocol in his enzyme therapies. And yeah, I think enzyme therapy can be a great protocol, especially for colorectal, liver, and pancreatic cancers. Question about chemo was also in regard to diet. Resume the diet the day after chemo. If so, any particular time of day, does it depend on when to finish the infusion? So as far as fasting, so the chemo protocol and then fasting, yes. So what we say in the chemo protocol, you fast the day before chemo, so 24 hours. So if your chemo infusion is at 9 o'clock Tuesday morning, like in this example, then you would start fasting 9 o'clock Monday morning, and then as soon as you come home from chemo infusion, then you could eat. 150 pounds, that's related to the question back here. Blended smoothie, I'd say, probably 8 to 12 ounces in the morning and 8 to 12 ounces in the afternoon. My weight dropped to 96. In order to gain weight, I thought I would try Kate Farms. Do you think this is do you like this as a calorie drink? Well, it is a cleaner calorie drink for sure. But always when you want to gain weight, you want to make sure that you're adding some carbs back to your diet. So if you go to the that little thing on the member site and search for cachexia, and you'll be able to see some ideas that I have on there, what to do for cachexia, meaning weight loss. You're not in a cachexic state unless you're technically losing 2 to 4 pounds a week, no matter what you're eating. But still, if you're trying to gain weight, you need to add some complex carbohydrates back to your diet. Pam said her enzymes, one pill includes amylase, peptase, trypsin. Okay, I'll have to look at that and see. I noticed a video sent on testing and taking so many supplements overwhelms the liver. What type of testing? That will be the cheek swab test. I'm at a crossroads to what I really need to do for my body. Nodes are stable, but some progression at the bone, not having bone pain or transformation at all. Previous email meant and Duke wants another PET scan in March, and setting up to go to the Prunovo scan. So that's great. We talked about that Prunovo scan. So yes, I would just go back and do another cheek swab test so we can check anything that we need to tweak on that. After using pancreatic 10X with trypsin and chymotrypsin in one capsule from Professional Formulas. So that's we have that product on our store. I'll show you right here. So she's talking about this product right here. So that does have a lot, 100,000 and 40,000. Thank you, Shane, for that. Appreciate that. It says if this is good, how many a day would be effective? Well, again, that's going to be different depending on your weight, depending upon your type of cancer, depending on your body type. Some people, could take, if a person has pancreatic cancer, they're trying to deal with that, you're still going to be taking 10 of these in the morning, 10 in the afternoon, at least 5 to 10, and right before you go to bed on an empty stomach. So that's the idea of enzyme therapy. You're taking it on an empty stomach. You're not trying to use the enzymes to digest your food. You're trying to get your body to absorb the enzymes so that enzymes can digest the waste layer around the cancer. Any comments on MMS? So MMS is miracle mineral supplement. It's also called chlorine dioxide. It's the same thing. I think it's a great product. We used to use it all the time with our Lyme patients. We used to see a lot of Lyme patients. I've said that before. We used to use MMS all the time with our Lyme patients. It worked great. They do have a cancer protocol as well. To me, I have a really hard time with when MMS came out, they were basically, it was sold like snake oil, and they would claim it cured everything. And I really, really have a difficult time with any company that does that. Matter of fact, you could probably find the video online where, I don't know if it was 2020 or Dateline or 60 Minutes or something, snuck into one of the guy who started MMS. His last name was Humble. Snuck into one of his meetings and videotaped his meetings, and it was just embarrassing for any nutritional salesperson because they claimed that it would basically grow new limbs. And so I have a hard time with any company that does that. So I really struggle with MMS that way from an emotional standpoint. But getting over that, I think it can be really, really helpful in killing, in direct killing bacteria and other fungus and parasites. So I think there can be benefits to it hugely with that. I just really struggle with why it would help cancer. It just doesn't make any physiological sense to help with cancer. Makes all physiological sense to help with infectious disease. So MMS for like COVID, MMS for any type of viral, parasite, bacterial, Lyme disease type thing. Yes, I think it could be very, very helpful. Do I have enough of the delta tocotrienols in the immune packs for my tinnitus? Wondering if all the detoxing triggered tinnitus. Possibly that could be the detoxing. Stress, that could trigger tinnitus. I'll tell you that right now, because what does stress do? It contracts the vessels. So if you already have some plaque in the vessels on a terminal vessel, that's going to make it worse. The immune packs. So let me search that real quick. And I forgot what's in there. So that has the 80K. It has delta tocotrienols in the D that is in there. Maybe that's enough. That's certainly a good supply for your heart. If you're having condition-specific issues, sometimes you want to ramp it up on the delta tocotrienols. But I'm not saying that is your tinnitus issue. There is also a tinnitus program on the Rife. I'd suggest trying. We've had people that said it helped. After how many years of clean eating, do you think it's safe to cut back on gut healing supplements or possible to muscle tests? Yes, Yep. I mean, the thing is that you got to remember that you always are damaging your gut. So even if you're eating clean, you're still getting pesticides and herbicides, you're still getting GMOs, the worst thing that damages your gut. If you go out to eat, you're certainly getting GMOs that are so damaging to your gut. So by cutting back, I would say to pulse them. So instead of, oh, I'm going to go to less, I would stay on the same dose, but then maybe go 2 weeks on, 2 weeks off, or, a week on, a week off, or I'm going to go Monday through Friday and not take them on the weekend, something like that. That's what I would do. How much beef heart is too much in a month to eat? Is your question beef heart, HEART? I'll let you answer that on this so I know exactly what you're talking about. What is your opinion on taking CBD and THC oil? So there is literally no downside to CBD. I haven't even heard of anybody that has a sensitivity to CBD. So there's no downside to CBD. CBD can act like a flavonoid as far as anti-inflammatory goes. It can be good for the brain. It can be calming for the brain. CBD has those benefits, but CBD is not like like a pain reliever. Like I'm just going to take the CBD and my pain's going to go away. Similar to if I took a Tylenol or an Advil. THC, on the other hand, is the psychotropic type of of the cannabinoids, and that's what's going to give you the high. So THC has some negatives. It has some downsides. It's going to make you feel loopy. THC in a low dose can be really good for just helping you sleep, helping with anxiety, helping with stress. If you're taking high dose in what you just said, Rick Simpson oil, or which said RSO, so that's the high dose CBD. So it's boiled down, it's distilled down till this paste, and it comes in a syringe, and it's very tar-like. You put it on your finger, and you have to literally scrape it off your finger with your tooth because it's that tarry like. Very high concentration, and that is what is used for a quote unquote cancer killing protocol. I am very much a fan of it. Very much a fan of it if you can tolerate it. Okay, so I took RSO, and a number of years ago when I was really doing really poorly, I was willing to give it a try. Holy cow, I'm kind of, I've never smoked a cigarette or, gotten drunk. I've been just lived kind of a clean life that way. I really reacted to RSO. I took too much of it to begin with. That was the problem. And it's became a really funny story around the office. But besides that, I don't want to get too deep into that. I had to go off of it for a while, and I tried to go back on it. It just makes me really loopy. I just don't feel good with it. So everybody's a little bit different. So if you're going to try that, I'd highly suggest trying it. Don't shy away from it, but go slow. Just go slow on your dose. Now, typically in RSO protocols, you start with 1 grain of rice 3 times a day. That would be way too much for me. It might be too much for you. So I would say even go start slower than that. Can we take lesser capsules of the pancreas? Absolutely, yes. You can. It's always good to start slow on anything. So, good question. Yeah, I think it's good to start slow. You're still going to get benefit. I mean, literally with enzymes, you cannot go wrong with enzymes, period. Nobody can. So they're so good for you. We're so deficient to them because our pancreases are so hyper stressed these days. Really can't go wrong with enzymes. So talking beef heart. So is there downside to having too much beef heart? Well, There's a question that nobody's ever asked me before. So eating or animal organ meat, you have to be careful of a couple things. You want to get them as clean as possible, meaning that you know the source, that organ meat is clean. Those beef cattle were out on a field that was never sprayed. They're eating organically because your organs will pick up the majority of your toxins ultimately, even more so than the muscles. So we try to eat organic hamburger, right, or organic chicken, but then we're not eating, really clean source organic organ meat. That's a bigger mistake. So make sure if you're eating beef heart, like because you're growing your own beef and you're eating beef heart, you're eating, that the source and it's clean. Secondly, what's the benefit of eating beef heart? Well, eating organ meat can be the most nutritious for a person. So if a person has a heart problem, eating beef heart would be really good for you. But even short of that, it's still going to be a good source of protein for a person as well. I don't think there's a downside of eating too much. I guess I don't know that much about the fat equivalent in beef heart and such like that to answer that fully. But organ meat can be really good for us if we have a good clean source. I had a new CT scan today with contrast. It appears that there was no new findings and I'm stable. That's fantastic. I see my oncologist on Friday for the full review. One line in the CT says stable mild sclerosis along the right anterior fifth rib near the costocartilage junction, no new lesion. So how do you explain that? Stable means it hasn't become any worse. Mild is mild, moderate, and severe. That's how a radiologist reads anything. Sclerosis is build up of bone on a bone. So a sclerotic bone is an increased calcium laydown of the bone. Along the right side, anterior front fifth rib, near the costocartilage. Costo means rib, cartilage is the cartilage. So your ribs in the front don't attach directly to the sternum, they attach through this cartilage. It's called your costocartilage and the junction there. So it's probably out about 2 inches from your sternum on the right side, your fifth rib down. That's where the sclerosis was. So when you have sclerosis of a bone, it could be because of arthritic sclerosis, could be because of an old injury, it could be because of an old break, it can be because of in sclerosis in a joint is bad because that's arthritic, usually degenerative, sometimes inflammatory arthritis that causes sclerosis, and it's going to cause issues in the joint, and you're going to have pain and swelling and such. If it's in the bone itself, it can be because of an old injury. If you got hit in the chest with a softball, you could have sclerosis there, but you could have also sclerosis after metastasis of cancer to the bone, that your bone is now healing. So the sclerosis would actually be a good sign of healing bone. So remember I said almost all metastasis, cancer metastasis to bone is going to be lytic, meaning the bone is being eaten away. And radiologists may use phrases like moth-eaten or rat bite lesion. Those are all radiology terms used for lytic erosion, a loss of bone. That is always pathological, meaning that it is always from a disease. So sclerosis can be non-pathological sclerosis. It can be from an injury, like I've mentioned, or it could be pathological sclerosis that's healing from a lytic lesion from cancer. Your body is healing that. Where can you get good RSO? Oh boy, it's available in lots of different ways now. There's so many states that it's legal in. So you can check in the legal states at a supplier and look at RSO. There's also RSO groups on Facebook and Telegram. So I would search those where people have trusted sources of RSO. Is your CBD oil 2,000 milligrams the same as RSO? No, not even close. CBD and THC are completely different. So no, the CBD 2,000 milligrams has no THC. We don't sell any CBD that has THC, and we can't legally do that. If given the choice, what's better to do, or does it matter? A CT plus bone scan or a PET scan? I don't know if my new oncologist will want me to do a follow-up or what my insurance will cover. I think a PET scan is probably better. But if your oncologist says, no, I think the CT bone scan, then have him tell you why. So he'll give you a reason why. Is metastatic bone disease same as metastasis? Metastasis is a metastatic movement of, so metastasis is when cancer spreads to another place in the body. If it spreads to the bone, then it's called metastasis to the bone or metastatic bone disease, or they may describe it as metastatic lesions in the bone. There's a lot of different ways to describe it. So if it metastases to the bone, it's metastatic to the bone. If it metastasizes to the liver, then it's metastasis to the liver. Remember, wherever it metastasizes, let's say if you have colorectal cancer, it metastasizes to the bone. It's not bone cancer, it's colorectal cancer in the bone. If it metastasizes to the liver, you don't have liver cancer now, you have metastatic colorectal cancer to the liver. A little confusing, but it's the cells that break off. If you just think of it that way, the cells are breaking up, looking for a place to set up another home. And so they're the same types of cell. Could my excess green smoothie drinking be causing weight gain? Probably not. There's not enough calories in your green smoothie to cause weight gain. I'd say no. Can AST and ALT liver test show if the liver is congested or not? Well, if your AST and ALT are elevated, then certainly that's the first thing you think of is liver congestion or liver toxicity. So when you say liver congestion, you're really talking about toxicity to the liver. And the number one cause of that is a medication. Okay, with that, I think we will say good night for the night. Thank you for being on. And we will talk again next week. Have a blessed week. And I'll be praying for all of you. Bye-bye.